This video is about cardiac tamponade. In cardiac tamponade, the heart is surrounded and squeezed by fluid. So, the heart has a protective bag around it called the pericardium. The problem with this bag is that any fluid from the heart or aorta that leaks into the bag cannot get out. Therefore, the heart is stuck sharing space with that fluid inside the bag. The next question is how fluid can get in. The short answer is injury to the heart. It can be a traumatic injury, a surgical mistake, heart attack, heart cancer, as well as inflammatory causes of the heart such as infection, autoimmune, and a buildup of toxins due to kidney failure. The problem with the heart being squeezed is that the heart cannot stretch to fill with blood. This means less blood will be delivered throughout the body. Now, a person won't say, "Help, my heart is being surrounded by pressure." First, the person will say that one of these situations has happened to them. In addition, the patient will have signs such as feeling chest pain, lightheaded, short of breath, and in the doctor's office, the doctor will see that the patient's blood pressure is low, the veins on the neck are distended, and when they listen to the heart will be quiet. These three signs on the right are known as Beck's Triad and are highly suspicious for cardiac tamponade. First up, we get an EKG. An EKG is this paper that has the lines going up and down, and they're good to do first because they are fast. On the top, we see a normal EKG. On the bottom, we see an EKG of someone with cardiac tamponade. On the top one, look at these peaks marked with R. See how they are the same height? On the bottom one, we see the heights go down, up, down, up. The reason they go up and down is that in cardiac tamponade, the heart is submerged in fluid, and while in the fluid, the heart has a bobbing motion. We can do an ultrasound of the heart called an echocardiogram. Specifically, we do what's called a fast exam because it is an ultrasound that's looking for fluid next to organs. If a patient has a cardiac tamponade, then the echocardiogram will show the weaker side of the heart, the right side, collapse because of the increased surrounding pressure. Chest x-rays of someone with cardiac tamponade are normal. They are done to make sure it's not another disease that just looks similar to cardiac tamponade, such as a collapsed lung. Next, we'll talk about the treatments that are done. Treatment choices are either pericardiocentesis or pericardial window, also known as pericardiectomy. Both have their pros. Pericardiocentesis consists of sticking a tube into the sac and draining the fluid. Pericardiocentesis is the number one choice if the patient's vital signs are unstable and timing is a priority. The procedure is cheaper than surgery, no anesthesia is needed, and therefore no medication side effects. Lastly, the procedure has fewer complications. Pericardial window, pericardiectomy, is the other treatment option. The plan is to make a hole in the pericardial sac to let the fluid out. One pro of this option is that the doctors can look at the heart directly and see the damage caused by any trauma. Another pro is that doctors can take a piece of the sac and examine it under a microscope for any damage or cancer. Lastly, surgery is more likely to fix the issue. After the treatment procedure, the patient should stay in the hospital for 1 or 2 days to observe their condition and vital signs. Before the patient leaves, an echocardiogram should be done to make sure there isn't any fluid. Lastly, the patient should schedule for another echocardiogram in 6 months. Thank you for watching.